Inflammation caused by our diet can lead to heart disease, diabetes, and cancer. But if you eat a plant-based diet, you can reduce your inflammation and cancer risk. In this video, I'm going to explain what inflammation is and why it's dangerous to our health. Then you're going to discover why animal products can increase your inflammation, and finally, you will discover how to reduce your inflammation with a plant-based diet. Inflammation is the immune system's natural response to injury or illness. There are two types of inflammation, acute and chronic inflammation. They have different causes, symptoms, and purposes. Acute inflammation often happens because of external injuries or accidents. Some signs of inflammation caused by an injury include redness, pain and tenderness, swelling, bumps or puffiness, warmth at the injured site, bruising, stiffness, and loss of mobility. Acute inflammation can last anywhere from a few days to a few months. During an injury, white blood cells triggered the release of several inflammatory chemicals. Some acute infections cause local inflammation. Most conditions caused by inflammation tend to end in itis, such as acute bronchitis, tonsillitis, acute appendicitis, sinusitis, or infective meningitis. Chronic inflammation can last for years or your entire life. It often begins when there's no injury or illness present. Chronic inflammation can cause diseases. The most common ones are diabetes and heart issues, but it can also cause other diseases such as high blood pressure, high cholesterol, kidney disease, various types of cancer, depression, neurodegenerative disorders like Alzheimer's, osteoporosis, and fatty liver disease. Chronic inflammation often progresses with few symptoms and is a threat to a large part of the population. There's no single test that can diagnose inflammation 100% or the conditions that cause it. But there are some tests that can give your healthcare providers some clues on what's going on. Blood tests can look for specific biological markers that show that inflammation is present. One such test is C-reactive protein CRP. CRP is a protein produced in the liver in response to inflammation. High levels of CRP are typical in people with chronic or acute inflammation. Another test you can use is erythrocyte sedimentation rate, MRI with gadolinium enhancement, ultrasound with power Doppler, FTG, PET, CT, or nuclear imaging. Acute or chronic inflammation can cause pain, stiffness, distress, and discomfort. The amount of pain that you feel depends on the severity of the inflammation. The pain often comes from when the swelling pushes on sensitive nerve endings. Inflammatory substances can also enter joints and cause irritation and swelling. There are several reasons why our bodies get inflamed. One reason is when people don't exercise enough. When you exercise, your body produces anti-inflammatory substances that help you reduce inflammation. Smoking can also lower your production of anti-inflammatory molecules. Sex hormones like estrogen and testosterone suppress inflammation, and when you have low levels of these hormones, inflammation increases. Physiological stress and irregular sleep can also cause inflammation, and diets high in saturated fat and trans fats can also increase your risk of inflammation, especially if you're overweight. In this video, I'm going to focus on how our diet causes inflammation. Animal products are the most common cause of inflammation from our diet. In one study, they looked at the link between dietary patterns and inflammation. The scientists that did the study found that almost all dietary inflammation came from animal-based diets or the Western diet, and they also discovered that vegetable and fruit-based diets decreased inflammation. The reason why meat can cause inflammation is both the animal protein and the fat. In one study, 96 participants completed an 8-week randomized intervention trial. The study evaluated the effects of vegetable and animal protein on inflammation. The study concluded that animal protein caused higher levels of inflammation. Overweight or obese women have an increased risk of developing and dying from breast cancer. Inflammation may activate an enzyme that allows breast tumors to create estrogen. Too much estrogen in your body can increase your cancer risk. The compound that can increase your cancer risk is prostaglandin. Higher prostaglandin levels in women's urine correlate with breast cancer risk. A major ingredient in animal fats is arachidonic acid. Arachidonic acid creates prostaglandin. Prostaglandin and other inflammatory compounds can then stimulate breast cancer growth. These inflammatory compounds can also play a role in colon cancer, lung cancer, and head and neck cancer. For carnivores like cats and lions, arachidonic acid is an essential nutrient. But humans don't need it from the diet. We can produce it ourselves without our diet. It's like cholesterol. We need some cholesterol produced by the liver, but we don't need extra cholesterol from animal products. There are 10 different food groups that contain more arachidonic acid in the American diet. The worst one is chicken, followed by eggs and beef. You should also avoid sausages, Frank's bacon, ribs, fish, burgers, cold cuts and pork. There's also some arachidonic acid in Mexican mixed dishes, pizza, turkey, pasta and grain-based desserts. If you eat a strict plant-based diet, then you should be able to avoid most of these sources. A single meal high in animal fat elevates inflammation within our bodies. This process peaks at about 4 hours. We can measure the dilation of people's arteries and blood flow through ultrasound. Every time you eat animal fat, your arteries get paralyzed. The lining of our own vascular tree gets stiffened and crippled on just one meal of animal fat. And after 5 or 6 hours, we may eat a new meal of meat, eggs and dairy. And if we repeat this habit, we're stuck in a dangerous chronic inflammation cycle, and the result is heart disease, diabetes and cancer. The American diet can also cause inflammation of our lungs, so a single meal with animal fat causes internal damage right away. If you want to avoid inflammation in your body, then you need to avoid animal products. Eat a whole food, low-fat, plant-based diet. Consume starches, vegetables and fruits. It's vital that you keep your fat content low. There is the most troublesome food. It contains a lot of fat and causes inflammation and increases your risk of cancer. You should also avoid vegetable oils, even cold-pressed olive oil, because they are strong suppressors of the immune system. When you eat a low-fat diet, you retard the development of inflammation. Most vegetables and fruits don't cause problems in people's bodies, but there are some plant-based foods that can aggravate symptoms such as corn and wheat. Fruits and vegetables supply antioxidants and other phytochemicals that keep the joints strong and repair the damage. Plant foods also keep the intestinal barrier strong and the immune system in fighting condition. And your bad habits increase your problems such as smoking, alcohol, animal products and processed foods. People who eat high antioxidant fruits and vegetables are better at reducing inflammation. A double-blind randomized placebo-controlled trial found out blueberry smoothies could turn off inflammation. In this study, one group drank smoothies without blueberries and the other group consumed blueberries. Placebo participants got worse. While 6 weeks of daily blueberry smoothies lessened the inflammation, the blueberries were able to decrease free radicals in the participants' bloodstream. Free radicals are highly reactive and unstable molecules that are a byproduct of our metabolism. You can also get them from the toxins in the environment. Free radicals in the body increase the risk of diseases, and antioxidants from fruits and vegetables can reduce it. In the study, 6 weeks of blueberry smoothies cut the free radicals by half. Strawberries can also improve pain and inflammation in osteoarthritis patients. Osteoarthritis patients drank a pint and a half of strawberries a day or 12 weeks. The subjects that drank strawberries had reductions in constant, intermittent and total pain, and their inflammatory markers plummeted on the strawberries. Berries can reduce pain, inflammation, and improve the quality of life in obese adults. Herbs can also help you fight inflammation. Herbs have some of the greatest antioxidant activities known. In one study, each participant ate half teaspoon of herbs. They have different groups eating 10 types of spices. At the end of the week, researchers drew blood from participants and dripped the subject's blood plasma in petri dishes. Each petri dish had an inflammatory substance called oxidized cholesterol. The scientists measured how much human necrosis factor that the subjects produce. TNF is a potent inflammatory cytokine. Cytokines are small proteins essential in cell signaling. Black pepper didn't lessen the inflammation, but cloves, ginger, rosemary and turmeric stifle the inflammatory response a lot. If you want to reduce inflammation, then you should eat more berries, fruits and vegetables. If you enjoyed the video, please don't forget to like, share, and subscribe for more health tips.